You may have many questions about how to get pregnant, particularly if you have an underlying condition. Taking care of your body is a good first step to optimize your fertility. But what else can you do to improve your odds of having a baby? The most important advice for a woman who wants to get pregnant is to get to know her body, specifically her menstrual cycle, said Dr. Mary Ellen Pavone, a reproductive endocrinologist and infertility specialist. It's important to know how far apart her cycles are so she can more accurately time intercourse to try to get pregnant, Pavone said. We've highlighted the top 10 tips that may help increase your chances of becoming pregnant. You should still find this article and accompanying video on how to get pregnant useful. How to get pregnant, step-by-step instructions. Record menstrual cycle frequency. A woman who wants to have a baby should monitor the intervals between her periods. In other words, whether the first day of her period tends to occur the same number of days apart every month, which is considered regular. Conversely, her periods may be irregular, meaning her cycle lengths vary from month to month. By tracking this information on a calendar, a woman can better predict when she might be ovulating. This is the time every month when her ovaries will release an egg. There are also some apps that can help with the tracking, such as Glow Ovulation Period Tracker. A woman's egg is fertile for only 12 to 24 hours after its release, while a man's sperm can survive in a woman's body for up to 5 days. Monitor ovulation. Women with regular cycles ovulate about 2 weeks before the arrival of their periods, Pavone said. It's harder to predict ovulation in women with irregular cycles, but it usually occurs 12 to 16 days before the start of her next period. This variability means that it is best to monitor ovulation to find out when the person is most likely to conceive. There are several methods women can use to help determine their most fertile days each month. Home ovulation prediction kits can reduce the guesswork needed to figure out when a woman is ovulating. Sold at drugstores, the kits test urine for luteinizing hormone, a substance whose levels increase each month during ovulation and cause the ovaries to release an egg. The 3 days right after a positive test result are the best time for couples to have sex to increase their odds of becoming pregnant. Another method to predict ovulation is to track cervical mucus, which involves a woman regularly checking both the amount and appearance of mucus in her vagina. Just before ovulation, when a woman is most fertile, the amount of mucus increases, and it becomes thinner, clearer and more slippery. Basal body temperature is also a good way to monitor ovulation in most cases. To do this, check your temperature every morning at the same time, before you get out of bed, and keep a chart or record of each day's reading. A woman's basal body temperature right after ovulation averages between 97.6 and 98.6. This egg will remain fertile for about 12 to 24 hours after ovulation. Have sex every other day during the fertile window. The fertile window spans a 6-day interval, the 5 days prior to ovulation and the day of it. Every month, a woman is most fertile on these days. When a woman has identified that fertility window, should they have sex every day? Research has shown that there hasn't been a big difference in pregnancy rates between couples who had sex every day during the fertile window compared with couples who did it every other day, Pavone said. And having sex every other day might be easier for a couple to pull off. There are plenty of pregnancy myths about conception. For example, there's no evidence that sex position will influence a couple's chances of having a baby, nor does a woman lying on her back for a certain amount of time after intercourse increase the odds of conceiving. There are some water-based vaginal lubricants that can decrease the movement of sperm. Strive for a healthy body weight. A healthy body weight increases the chances of pregnancy. A woman's weight can also impact the chances of conceiving. Being overweight or underweight may reduce those odds. Research has shown that a woman who is overweight can take twice as long to become pregnant as a woman whose body mass index is considered normal weight, Pavone said. A woman who is underweight might take 4 times as long to conceive, she said. Having too much body fat produces excess estrogen, which can interfere with ovulation. Male obesity, which can disrupt the male endocrine system as well as sperm viability and concentration, can also affect a couple's ability to become pregnant. Women who are underweight, with a BMI less than 18, might not be getting regular periods or could stop ovulating, which also hinders their ability to become pregnant. Take a prenatal vitamin. Pavone recommends that women who are attempting to conceive start taking a prenatal vitamin even before becoming pregnant. This way, a woman can find one that's more agreeable to her system and stay on it during pregnancy, she said. Another possibility is to take a daily multivitamin, as long as it contains at least 400 micrograms per day of folic acid, a B vitamin that's important for preventing birth defects in a baby's brain and spine, Pavone said. Women to take 400 micrograms of folic acid every day for at least 1 month before getting pregnant, to help prevent birth defects. Getting a head start on folic acid supplementation is a good idea because the neural tube develops into the brain and spine 3 to 4 weeks after conception occurs, before many women may realize they're expecting. Eat healthy foods. The body needs the right nutrients for a healthy pregnancy. Although there may not be a specific pregnancy diet, eating a variety of healthy foods can help prepare a woman's body for pregnancy by giving her adequate stores of critical nutrients, such as calcium, protein and iron. This means eating a variety of fruits and vegetables, lean protein, whole grains, dairy and healthy sources of fat. Besides taking a supplement containing folic acid, a woman can also obtain this vitamin from foods such as dark green leafy vegetables, broccoli, fortified breads and cereals, beans, citrus fruits and orange juice. Also, some science suggests that pregnant women should avoid caffeine. Cut back on strenuous workouts. Being physically active most days of the week can help a woman's body prepare for the demands of pregnancy and labor, and has been associated with a reduced risk of fertility problems. But getting too much exercise or doing frequent strenuous workouts could interfere with ovulation. Doctors see a lot of menstrual disturbances in women who exercise heavily, meaning to the level of training for a marathon, for instance, or exercise equivalent to the training undertaken by Olympic athletes, and a lot of times these women need to cut back on their workouts. Be aware of age-related fertility declines. As women get older, their fertility decreases. This is because of age-related changes in the ovaries that cause a decline in the quantity and quality of their eggs. With advancing age, there's also an increased risk for some health problems, such as uterine fibroids, endometriosis and blockage of the fallopian tubes, which can contribute to a loss of fertility. There's a gradual fertility decline in women beginning in their 30s, a sharper decline after age 37 and a steep fertility decline after age 40, Pavone said. These declines mean that it may take longer to become pregnant. Kick the smoking and drinking habits. Smoking can lead to fertility problems in both women, and strive for a healthy body weight. A healthy body weight increases the chances of pregnancy. A woman's weight can also impact the chances of conceiving. Being overweight or underweight may reduce those odds. Research has shown that a woman who is overweight can take twice as long to become pregnant as a woman whose body mass index is considered normal weight, Pavone said. A woman who is underweight might take 4 times as long to conceive, she said. Having too much body fat produces excess estrogen, which can interfere with ovulation. Male obesity, which can disrupt the male endocrine system as well as sperm viability and concentration. Know when to seek help. Both the woman and the man should consider having an infertility evaluation if the woman is 35 or older and has not become pregnant after 6 months of having sex regularly without using birth control, Pavone said. Pavone also recommended that a woman who is under 35 and her partner should consult a fertility specialist if she hasn't become pregnant after 1 year of having unprotected intercourse on a regular basis. Polycystic ovarian syndrome, a hormonal disorder, is one of the most common reasons for female infertility. It affects between 6% and 12% of American women of reproductive age. Multiple small cysts on the ovaries. It is not clear why some women develop this syndrome, although it is often diagnosed when they struggle to get pregnant. A number of prescribed medications may also induce ovulation and regulate insulin levels, such as letrozole and metformin. Such medications work because high levels of insulin push the pituitary gland to release large amounts of hormones that disrupt ovulation. Another medication commonly used for treatment of infertility, including when the cause is PCOS, is clomiphene. A surgical intervention for PCOS is laparoscopic ovarian drilling, in which a surgeon makes small holes in a woman's ovaries to help reduce the number of male hormones they produce. we made extra efforts to produce such kind of informative videos. If you feel that this video gives you some kind of valuable information, then like and subscribe this channel. Share this video with your family and friends. Hit the bell icon, so that you will not miss any such kind of informative videos.